At the start of your Puregon treatment, and each time you need to change your Puregon cartridge, you take your Puregon pen and remove the cap from the pen by pulling it off gently. Unscrew the body from the cartridge holder and put it aside. For the next step, you need the yellow cartridge holder and a Puregon cartridge. Use an alcohol swab to gently wipe the metal end of the cartridge and then insert the Puregon cartridge into the yellow cartridge holder. Make sure that the metal cap goes in first. Screw the cartridge holder towards the body, making sure that the arrow falls within the aligned mark. Check that there's no space between the body and the cartridge holder. If there is space, unscrew the body from the cartridge holder and check whether the cartridge has been inserted correctly. The following steps should be performed every time you inject Puregon using your Puregon pen. To reduce the risk of infection, always use a new sterile needle for each injection. The cartridge holder must have a cartridge in it before you attach the needle. You can see the cartridge through the window of the yellow cartridge holder. Clean the tip of the Puregon cartridge at the open end of the cartridge holder with another alcohol swab. Take the needle and remove the protective paper seal. To keep the opened needle clean, never touch the exposed needle or place an open needle unit on the table surface. Hold the outer needle shield firmly and push the end of the yellow cartridge holder into the outer needle shield. Screw on securely. Puregon is designed for injection under the skin. Suitable places for injection include the abdomen or upper leg. Your doctor or nurse will advise the best place for you. Try to vary the site of injection just a little bit each time. Use a swab or piece of gauze moistened with disinfectant to clean the area where the needle will be inserted. Let the disinfectant dry for a moment before proceeding. Carefully remove the outer needle shield by pulling gently while leaving the inner shield in position. Now place the outer needle shield with the open end upwards on the table. Then carefully remove the inner needle shield and discard. Hold the pen with the needle pointing upwards. Tap the cartridge holder gently with your finger to help air bubbles rise to the top of the needle. The remaining presence of small air bubbles won't affect the amount of Puregon you receive. Before dialing the prescribed dose, you need to make sure that the needle is correctly primed. Every time a new, unused Puregon cartridge is loaded into the Puregon pen, always dial the dosage knob until you hear one click. With the needle pointing upwards, push in the injection button. Then look for the droplet at the tip of the needle. If you don't see a droplet, repeat this step until a droplet appears. You must make sure you see a droplet at the tip of the needle, or you may not inject the correct amount of Puregon. For doses from 50 to 450 IU, turn the dosage knob until the dot next to the required dosage is located between the two marks on the dosage scale. If you dial too far by mistake, do not try to turn the dosage knob back because you will waste fluid. Just continue to turn the dosage knob forwards past the 450 mark as far as it will turn. Then completely push in the end of the injection button. It slides in very easily, and redial, starting from 0 upwards. If you follow this procedure, you will not lose any fluid. After setting the device to the appropriate dose, you are ready to inject.